Let's talk about the elephant in the room. Hearing aids are expensive. And depending on where you go in Ontario, you may hear some numbers that make absolutely no sense. One clinic says 2,500, another clinic says 8,000, and one is saying BOGO, buy one, get one. Someone online says they got there for just a few $100. And now you're sitting there wondering, am I buying medical technology or a used car? So today, no fluff, no sales pitch, and no mystery pricing. Let's break down what hearing aids actually cost in Ontario. Now, before we dive into hearing aid pricing, I want you to make sure that you subscribe to our channel and like this video. My name is Dario Coletta. I'm a doctor of audiology, and I've helped hundreds of people in the Toronto area to achieve better hearing and solve complex cases of hearing loss. And today, I want to break down exactly why hearing aids cost what they do. In Ontario, the final cost is going to depend on a few things. Do you need one hearing aid or do you need two? What is the technology level of the hearing aids selected? The clinic model. Does that mean all of your care is bundled or unbundled where you're paying fee for service? What does your follow up or aftercare look like? Do you have follow ups? Is programming included? And what do your warranties look like? And lastly, do you qualify for any funding, such as in Ontario, the Assistive Devices Program? Now, here's the part that most people miss. You're not just paying for a tiny speaker in your ear. You're paying for the device, yes, but you're also paying for a prescription, a verified hearing aid fitting, programming, maintenance, adjustments, and follow up care. And that matters because a poorly fitted hearing aid is basically just an expensive ear decoration. I mean, I see it all the time. People come in from other clinics or devices they bought online, and when we run real ear measurements, the hearing aids are nowhere close to where they should have been. And they were essentially just wearing an earplug and wondering why it wasn't working. Now, before we dive a little bit deeper and find out hearing aid pricing, which we will get to, I want to take a little bit of a detour and talk about BOGO, or buy one, get one hearing aids. And this is something you'll see online. It's a marketing strategy that a lot of clinics offer to get you through the door. But I have a problem with it. I think one of the biggest problems in hearing healthcare is that hearing aids are marketed as a commodity. Buy one, get one free, massive discounts, and quick transactional sales. Hearing aids are not simply a product that's sitting on the shelf. They are prescribed medical devices that need to be selected, prescribed, programmed, and adjusted based on an individual's hearing loss, lifestyle, and hearing needs. When hearing aids are treated like a standalone solution, it overlooks what actually determines success: the hearing healthcare that comes with them. A hearing aid is only one piece of the puzzle. Proper testing, counseling, real ear measurements, ongoing maintenance, cleanings, wax removals. That's what helps patients truly succeed. The reality is that hearing aids are a journey, they're not a one time purchase. Yes, of course, the technology matters, but the ongoing relationship with your audiologist or your hearing healthcare professional matters just as much, if not more. Turning hearing healthcare into a buy one, get one sales pitch minimizes the importance of personalized care and creates the impression that all hearing solutions are the same when they're not. Okay, back to it. Let's talk government funding. In Ontario, the Assistive Devices Program is going to cover up to 75% of the cost of your hearing aids to a maximum amount of $500. Now, what does this actually mean? For an Ontario resident, this means that you are eligible for $500 per ear. So if we're needing one hearing aid or a system like a Cross or a Bicross, we're looking at funding of $500. If we're looking at a pair of hearing aids, we're looking at government funding of $1,000. And that's great. Now, a couple of rules. I mean, you need to be an Ontario resident. You need to have a valid OHIP card and have a hearing loss expected to last 6 months or longer. Now, age and income are not part of the eligibility criteria. So if somebody tells you the government covers the cost of hearing aids, I mean, that's partly true, but it doesn't usually cover the full cost. And when you go into a clinic, oftentimes when you're discussing hearing aid pricing in Ontario, the pricing is actually going to be after government funding because the clinic and the hearing healthcare provider you're working with are going to access that government funding on your behalf. And that clinic is reimbursed directly through the Assistive Devices program. So, oftentimes, when you're reviewing your hearing aid pricing, it's usually going to be after government funding. So, that is something that you want to clarify with when you are going into a clinic. So, here's the realistic breakdown. I mean, hearing aids come in different technology levels. We have our entry, our mid level, or what some manufacturers call advanced, and our premium level products. Now, for a long time, there was the assumption that if you lived a more quiet life, an entry level product was great for you. If you were still working or you found yourself in more dynamic or challenging scenarios, then premium was the one for you. Now, I take a different approach to that. I think at the end of the day, we want to wear the product that's the best one for you. I think those features that allow a hearing aid to excel in a really challenging environment also allow people to hear well in a quiet environment. So when it comes to what's the right level for you, I always give people two pieces of advice. Any level of technology or any hearing aid is always going to be better than no hearing aid. And you go with the highest level of cost that you are most comfortable with in your budget range. And here's the honest truth. The most expensive hearing aid doesn't mean that it's going to be the best hearing aid for you. Now, these are also going to range in price. If we're thinking about an entry level product in Ontario after government funding, you're probably looking at about at least 3,000 to 3,300 to start. Premium level products, we're going to see a range from about 6,000 to 8,000 depending on the clinic you go to. Personally, I think it's important to be transparent. We take a very transparent pricing model. All of our hearing aid prices are actually on our website, unlike many clinics who kind of keep them hidden but behind lock and key. Some clinics won't even let you leave with a quote. Now, I think it's important to be transparent with pricing. Too many clinics hide their pricing or don't actually allow you to leave with a quote. We have our pricing available online for everybody to see. I think it's important to understand what does hearing aid pricing look like sometimes before you even come into the clinic to make sure that you're comfortable. We put a lot of time and effort into creating our pricing that's truly reflective of the devices as well as the warranty and level of care that goes with it. The best hearing aid is the one that matches your hearing loss, your lifestyle, your dexterity, and your budget. I've seen people do beautifully with mid level technology because it's been programmed properly using real ear measurements and with follow up care. And I've seen people with premium level technology who absolutely hate them because the time wasn't taken to program them properly. So when you're comparing prices, don't just ask, how much are hearing aids? I want you to ask, what's included? Are follow up appointments included? Are real ear measurements being done? Is there a trial period? And what happens if I hate them? What's the warranty? What if they break? And what if my hearing changes? Because the cheapest option can become very expensive if no one is supporting you after the sale. And the most expensive option can still fail if the fitting is lazy or we're not using gold standard. So, how much do hearing aids cost in Ontario? The honest answer is it depends. But at least you now know what drives the cost. Now, I want you to remember these three things. Government funding will help, but it's not going to cover the full cost. Technology matters, but fitting matters more. And the right question isn't what's the cheapest hearing aid? It's what's the right hearing solution for my life? If this helped cut through the noise, subscribe to our channel, like this video, and share it with somebody who's been putting off hearing healthcare because hearing better shouldn't start with confusion.